All right. Hello, Swope Associates. As you're coming in, get ready to participate in a wonderful interview with Congresswoman Robin Kelly. I'm going to give you a little bit of information about her. She's involved in so many things, but let me give you a little bit of information about her. Definitely, she has dedicated her career to public service as an advocate for Illinois families, and she was elected to serve the 2nd Congressional District in 2013. Since then, she has been focused on any number of things, particularly economic opportunity, community wellness, which we care so much about, public safety across the state, and she has championed numerous initiatives such as generating job growth, reducing health disparities, and one that I know she is very, very passionate about, and that is ending gun violence. So I can't begin to tell you all the committees that she has served on, but she served on the House Energy and Commerce Committee, the Health, Communications and Technology and Innovation, Data and Commerce subcommittees, the Democratic Steering and Policy Committee. She has been the chair of the Congressional Black Caucus Health Brain Trust. I can't wait to hear about that. And she co-chairs the Congressional Caucus on Black Women and Girls. Now, she has really been dedicated to championing gun reforms, and she has been responsible for community policing. She wrote a report, the 2014 Kelly Report, which was all about prevention of gun violence in America. And this was the very first analysis of the nation's gun violence epidemic. She was raised by a small business owner and a postal worker, and moved to Illinois, where she attended Bradley University in Peoria. Has a BA in psychology and an MA, get this, in counseling. And she received her doctorate in political science from Northern Illinois University. She lives in Matteson, Illinois with her husband, Dr. Nathaniel Horn, and has 2 adult children, Kelly and Ryan. Welcome, Congressman Kelly.
Thank you so much. It's really an honor to be before you. So hello, everyone, and good afternoon. And thank you so much for inviting me to speak. I told Janice this already. If I look a little crooked on the screen, I'm actually in a wheelchair. I tripped and broke my ankle in 3 spots on Sunday. So I need to slow down. But I am Robin Kelly, and I've been proud to represent Illinois 2nd Congressional District for nearly 10 years. The district is urban, suburban, and rural, and it changed greatly in January because of the redistricting. I used to start on 53rd and Cornell and go all the way to Kankakee, and I had all of Kankakee County. Now I start on 43rd Street, and believe it or not, I go south of Danville and west of Pontiac. So I have the biggest Democratic district in Illinois. So my constituents live in urban communities, suburban neighborhoods, and rural towns. I represent almost 2,000 farms and parts of the city of Chicago. While these places may feel very remote from one another, I have the privilege of going to Washington, D.C. to fight for all of them. And often the interests of these communities align much more than people may think. As a former counselor, as you heard, I know how important access to healthcare is for every family. And I also know that so many families do not have equal opportunity to access critical care. Racial disparities are still impacting millions of people of color trying to access adequate care. And that many people who live in rural areas are watching hospitals and healthcare centers close, leaving them with no option other than to travel far away from their homes to seek treatment. This is especially pronounced in an issue that I'm incredibly passionate about, the health of our moms and our babies. 1/3, as I'm sure you guys know, of maternal deaths occur between 1 week and 1 year after delivery, and Black women are 3 times as likely to die than their white counterparts. Even when a Black woman is wealthy, well-educated, and well-connected, it doesn't matter. She is still more likely to die from childbirth than a white woman. These are the systemic disabilities or disparities that I'm trying to change in Congress. The Medicaid payment pays for about 40% of all US births in 2019, but the Medicaid coverage gap put continuous healthcare coverage out of reach for over 800,000 women of reproductive age, and 2/3 of these women are women of color. I was proud to lead the effort to extend the Medicaid postpartum coverage option to 1 full year, which provides critical coverage to mothers in the most critical time after they give birth. While we're still working to ensure that every state provides this coverage, 33, and we're hearing rumors that possibly 34 states will soon have already implemented this extension. This effort was a part of my legislation called the Mamas Act, which is a comprehensive framework to improve maternal health outcomes and reduce bias in maternal patient care. The other issue I want to briefly touch on today before I take your questions is what Janet talked about, the public health crises of gun violence. Gun violence is the leading cause of death in our country, and we need to start addressing it. It, like the public health crisis, it truly is. The tragedy of gun violence is not just about the shootings you hear in the news. Thousands of deaths every year are part of what I call a slow motion massacre. I know too many moms who have lost their sons and daughters to random shootings, stray bullets, and senseless violence that likely would not have happened if common sense gun laws were in place. The proliferation of guns in our communities creates a cycle of violence that results in more poverty, less access to healthcare, less access to education, and ultimately more violence. And we can end this public health crisis, and the solutions are right there in front of us. I just introduced the Federal Firearms Licensing Act to modernize how we regulate firearms sales. We need universal background checks, red flag laws, and more support services for survivors. I was happy to see that President Biden announced an executive order to take more action on gun violence. And we did pass the first piece of legislation in 30 years, the last Congress. We just have to make sure everything is implemented because we must stop this cycle of violence. I know you're here today because you're invested in solving these challenges. And I want to thank all of you for your dedication and encourage you to please stay involved. Representatives like me rely on your input to make the best decisions possible. We know we don't know everything, and we do really rely on our constituents and different organizations, different experts to inform what we work on or decisions we make or how we vote. So I want to thank you for hosting this event. And I want to thank you for being on the ground doing the work to advance health equity. And it's organizations like yours that I rely on to make policy a reality. So thank you so much for having me today. And I look forward to answering your questions.
Wow, you are very, very, very busy and involved in a lot of things. I can tell you're just so passionate about what you do.
Yes.
So how did this journey even start? How did you even get on this journey to get involved in politics and become a congresswoman?
Well, I will tell you, I never, ever, ever, ever thought that I would run for office. I thought that I would, I have a master's in counseling. I worked in social service. I did counseling and different things like that. And I was just minding my business one day, actually, and 5 men came to me and asked me would I consider running for state rep, which was 20 years ago now. And I said, no, I can't do it. I'm sensitive. I'll cry if they talk about me in the paper and all of that. But my family, friends, and others convinced me to do it. And I actually ran against a 10-year incumbent and I won and served for 4 years. And, I was off on my political journey.
So what was the issue of the time when you were running that you really built your campaign around?
Well, when I first ran for state rep, it was more around economic development. Okay. But in running for Congress, economic development is always a part of what I do, but really it was gun violence that I ran on. When I announced that I was running, it was a special election because Jesse Jackson Jr. decided he was going to step down. That's when Newtown had happened, Idea Pendleton happened, and then it just kept happening on and on and on. And actually, as a state rep, the first bill I passed was around straw purchasing. So, and that continues to be a problem. People talk about, oh, Chicago has the strictest gun laws, but yeah, we do. But if the states around you or the counties around you don't have that, then you have trafficking and then you have straw purchasing. So that's what I ran on, gun violence prevention, because it affects if people want to move in your neighborhood or stay out of your neighborhood. It affects education. It affects so much economic development, if people want to have a business in your community or not. So it's so very important.
All right, so they approached you about running.
Right, right.
Okay.
5 guys, some mayors and some people,
Uh-huh.
that have been political.
Okay, that is wonderful. So they must have just really seen how passionate you were about what you were currently doing. And were you a voice in your community for
Yeah,
certain
I
things?
actually was a director of community affairs for the village of Matheson, where I still live. So I worked with a lot of the surrounding communities. So they saw the work that I did around a whole lot of issues, and bringing communities together, a lot of collaboration, fair and affordable housing, work around diversity, work around economic development. So they saw me in action for 9 years before I even ran for office.
Wonderful. So what did your parents think? You grew up in Illinois, right?
No,
Yeah.
I'm actually a New Yorker. I grew up in New York. I came to Illinois to attend Bradley University.
Okay, so you grew up
Yeah,
in
but well, both my parents are like, because my dad said, you're going to get into the dirtiest game in the world. I said, well, good people don't get in. It will always be dirty. My mother was a little more supportive. She was more the daring one. But no, they were actually, before I won for state rep, my dad died. So he never saw me, but my mom did. She never saw me become the congresswoman, but she knew that I was a state representative.
Wonderful. So in your career, you probably have had a lot of firsts. This
Oh.
is Women's History Month. We just finished Black History Month. So talk about some of the firsts that you've had, either as a woman or as a Black woman.
Well, I can talk about both. When I worked at Bradley University, I was a director of minority student services. I was the first woman to be in that position. When I came to the village of Matheson, I was the first Black person to be a department head, period, in all those years. And when I became a state rep in parts of the district, it was the first time that they had a Black person or a woman, depending on what part of the district. And then definitely when I was the chief of staff to Alexi Janulius, I was the first Black female chief of staff. When I was the Cook County, and I worked there as the chief of the administrative offices, I was the first Black and woman. and then in this, as the chair of the party, I was the first Black and the first woman. So I've knocked on a lot of glass ceilings, and in parts of my district now, either the first Black or the first woman, depending, because you know how the district changes. So no, I've been in that position quite often.
Okay. So first you were in the state, at the state level, and then you moved up to the national level. Huge change or pretty similar?
Well, actually, I've worked on every level of government, the local level, county, state, and federal. The change is that we deal with national problems and world problems, the things that, we vote on doesn't just affect the state of Illinois, it affects, the United States, our territories, and depending on what we're voting on, like whether we should give money to Ukraine or not, that affects, the world, essentially, or what we give to the military and those kind of things. So I think, that's a bigger difference. And then also I'm working with people, from all over the United States. That's a big difference. But it's a joy, you learn so much of why, people vote like they do or who they represent. And I'm actually involved in a program that Democrats and Republicans do an exchange. So I just went to one of my Republican colleagues' district, and he just came to mine to hopefully build a better understanding of why we vote like we do. But I also took something I used to do in the district with some other folks, took what we call diversity dinners, even I call it breaking bread, to Congress. And I found 3 Republicans and 3 Dems to help me, and we would cater dinner for the rest of our colleagues. And we just would get together just to get to know each other, nothing to do, with politics. We haven't done it for a while because of COVID, but just, I've always been a collaborator and, building relationships and those kind of things. I think it's really important.
Speaking of collaborations, for the first time ever, we have more women and more Black women in Congress than ever.
Oh, definitely. Well, on the Democratic side, we've really been building the amount of women, and there's now, we have 58 Congressional Black Caucus members, and it's almost 50-50. I still think it's more men, even though we just got another female, so I'm not sure now. But yeah, we are building. And then if you look at women of color, especially, but even on the Republican side, they even have a few more women than they had, because I was in committee meetings where there were only 1 Republican woman because they didn't have enough. But they're mounting a little bit, also. And now there's they have 4 Black Republican Congress people, all men. Since women are the backbone of the Black women of the Democratic Party, but all men on the Republican side. But yeah, it's definitely more diverse, but representation matters. It really matters. So
do you women who are all a part of this huge conglomeration, do you all connect and hang out? Or?
Oh, definitely. We there's a lot of, we all come together. There's a women's caucus, there's a Democratic women's caucus, a Republican women, then there's an overall caucus where the Democratic women and the Republican women work together. But then, there's different entities, the Congressional Black Caucus, Congressional Hispanic Caucus, but people are very supportive of each other. That's what I've found. And also when we travel together, depending on what committee you're on, you get a chance to really see people in another light, not under the light of, Washington, D.C. So like I have Republicans I know I can go to, and they used to say I had popcorn diplomacy because I would bring Garrett's popcorn in for the Dems, and then some of the Republicans tasted it. So I bring popcorn every week. I bring popcorn. I said I should buy stock. Every week I bring Garrett's popcorn in for somebody. But yeah, no, we all hang out, support each other. If someone needs some, like I'm hearing from people because they're slowly finding out that I messed up my ankle, so people are very supportive, much more than I think the news would have you believe. Yes, there's some people I don't want to have a lot to do with, but there's many more that are decent and trying to do a good job.
Okay, so did things change at all for women when we got a woman vice president?
Oh yeah, I think so. Like again, representation matters. I work a lot on maternal mortality, and Vice President Harris had a nationwide seminar or focus on it. Oh yeah, because they can bring issues up to a whole nother level, so no, it definitely matters that Speaker Pelosi was a speaker, that matters, that Hakeem Jeffries is the leader now, and we hope soon to be the speaker, that matters, it definitely matters because people bring different things to the table.
Yeah, and I'm with you on that Garrett's popcorn with everybody. I probably order it every 6 months, trying not to eat too much. So my colleagues really don't even know this about me, but I served as an intern for Bill Clay back when.
Oh my gosh!
Yes,
and I'm good friends with his son, Lacey.
Yeah, Lacey was hanging around too, so I know Lacey too. But when we got letters from all over the place, and with you having such a wide diversity in urban and rural, how do you manage what you're going to support and give feedback to your constituents?
Well, I try to come from the standpoint that no matter where you live, most people want a job, they want a roof over their head, they want decent education for their kids, they want healthcare, and they want to feel safe. I know there's other things too, but those 5 things, I think, pull my district together. There's definitely just differences, like around the whole gun violence thing. There's a lot more gun owners the further I get out of Chicago, and I've had, pushback and those kind of things. And my district is very, not only geographically diverse, but I'm diverse as far as ethnicity and, racially and those kind of things. But I have a fantastic staff and they help me do the job that I do. I could not do it without them. We have various like roundtables or advisors that will, guide us or help us out with some policy. But, we get a lot of letters, but I have staff that answers every single one. And we take a lot of meetings.
I'm sure. I am sure. So what's your schedule like? How often are you in DC versus back in Illinois?
I usually go to DC every week. Either we start on a Monday at 6:30 and we get out Thursday, or we start on a Tuesday at 6:30 and we get out on Friday. Now, if there's a holiday or something, then we're usually home that week. Like we'll have recess from DC. We call it district work periods and we work in our district. And sometimes we could be off 2 weeks in a row. That's unusual, but it might be like a week around July 4th or Memorial Day and those kind of things. And then in August, we shut down completely from DC and people work in the district or go on vacation or, a congressional trip or something like that.
Okay. So how long have you been in Congress?
My 10th anniversary is next month.
10th anniversary. So were your children young or were they already grown back then?
No. When I ran for state rep, my daughter was in college. My son was like in his last year or next to last year of high school. They were happy I was out. And no, my kids are grown. I have my own 2 kids. I have 2 stepdaughters and 2 grandsons from my 2 stepdaughters that I'm crazy about. And so no, they were adults.
Okay. So
there's a lot of people that have, young, I don't want that to be something that stops people because there are a lot of people that had children while I was a state rep or in Congress and, those kind of things. There's a lot more support, for that now. And then like in my office, when you have a baby, everyone gets 3 months, whether you're the mom or the dad. We have a support system. We think that's really important, in the federal government, actually. We try to be very, very supportive. We think that's important.
Yes, as women, we learn to do it all, right?
Yes, we do.
So let's talk a little bit about the Mama's Act and how that came about.
Right. I didn't realize until I got a phone call from a constituent how prevalent maternal mortality was. But someone called me to discuss the issue around Judge Hatchett, who comes on TV. She actually lost her daughter-in-law and she could not get any attention. And so that's how I really got involved, probably like, oh Lord, I don't even know how long ago, maybe 7 years now or something like that. And when I found out about it, we had a forum in DC and so many people came. Even the photographer told me it happened to his daughter. So the more we dug into it, the more I learned and what a big issue it is in the United States. And according to the CDC, at least 80% of the deaths are preventable.
Wow.
Yeah, we have to train differently. We have to look at biases that, people have. One thing we really pushed, like, as I mentioned, was covering the longer postpartum period. We have to get best practices out, like why does it happen in some areas more as opposed to other areas? We have to have more support.
So is it more the prenatal care, the lack of prenatal care, or what
I think it's a combination of things. Some people, did everything they were supposed to do. Like in the case of Judge Hatchett's daughter-in-law, she, educated, had resources in a great hospital, but when the doctor ordered the test that she needed, they took their time doing the test, and by the time they did it and opened her up, she died on the table. So Yeah, it's a lot of different reasons. Also, we Black women, we have more high blood pressure, overweight, and those kind of things. So it is really important, the prenatal care, and that we take care of ourselves, and that we have, doctors that help us do that. So, and I do a lot of different workshops, and I remember one doctor, a Black doctor, said that he plays tennis a lot, and that he hurt, I guess he had tennis elbow, hurt his elbow. And when he went into the doctor said, oh, you could do this, or you could do that. And then when the Black doctor said, oh, you don't think I should do this? Because he was wondering why the doctor didn't prescribe more things or look at more things. And then finally, excuse my voice, the doctor that was doing the treating said, oh, you must have some kind of health care. And when the doctor said, yes, I'm a doctor, that's when the treatment got a little better. And it should not depend on, if you're a doctor or not, or how much money you have. Everyone deserves quality healthcare treatment.
So what is happening? Are doctors not getting specific training while they are in school, or are they not getting this type of additional knowledge, just even in their workplaces? What's
I do think it starts in schools, that training, and I'm saying this, speaking with, like ACOG, we worked with a lot, and other doctors, and or healthcare professionals. So these are some of the things that they suggested, that training needs to be, different. And I'm married to a doctor on top of it, that training needs to be different and better, and data needs to be collected. So, people could see. Something else we suggested with, like, review committees to go over, what's been going on, and comparing notes and those kind of things. So I think it's a combination of things. I don't think it's just, one thing that needs to be done. I think it's, like I said, a combination of things that, we need to do to make it better. But I mean, for the United States, that prides itself on a great healthcare system, and for this to be happening, there's no excuse.
Yeah, those numbers that you gave are so alarming. What would you tell a young woman who was going to have a child? What would you say to?
Well, of course, to take care of themselves. Like I had my two stepdaughters had children and many friends, and make sure, they, pick a doctor they feel comfortable with, pick a doctor they feel is approachable, that they can speak to. A lot of us still get intimidated, and just, take care of themselves. That's, put themselves in the best place to have a baby. And then after, or before, if they need help, whether it's physical or mental, ask for the help. Ask for the help. Because some of it is, mental health issues, also, or, people that, have postpartum issues. Don't be afraid to ask for help.
So let's talk a little bit about the Forearms Licensing Act.
Okay. Yeah, that is where what we want to do is close all loopholes that people have when they're selling guns, or when they're buying guns. That's the thing that people say that, oh, there's already a lot of laws, but there's loopholes in those laws. So that's like part of the issue. So we want to make sure that we're closing loopholes, and that we know who's like buying guns. Like, we know, it's so interesting because we know who buys cars and what type of car, but we don't know that, around the gun issue. So we want to make sure we have the data, and that, any loopholes, like even in, let's say, background checks, that, a mom and pop, let's say gun store or whatever, you buy a gun, they have 3 days to check your, if you should have a gun or not. But sometimes that's not enough time. So if it doesn't come back definitively no, they can still send you the gun. or sell you the gun. And there have been times where it doesn't come back definitively, no, they sell you the gun, and then they come back and say, oh, don't sell them the gun. And that's what happened with Mother Emanuel, that church in South Carolina, that it didn't come back definitively, no, they sold the gun. And then after it was too late, then it was, oh, you shouldn't have sold him the gun. So we're trying to, close those loopholes. And also the other thing is, it's not just that part. We have to invest in our young people. We have to invest in our neighborhoods. We have to make sure that people have hope and opportunity to do other things. So they're picking up, job skills and good hobbies, not, picking up guns. It's again, not just one answer to this problem.
So you produced your report back in 2014. I'm sure the numbers have gotten worse since then.
Yeah, I think so. I mean, some of the things that we suggested, we were able to get some things passed last with a host of my other colleagues last Congress, but there's still, like, again, we don't have universal background checks yet. People can't believe that, but we don't. But, we're dealing with ghost guns that people can make. And also, when you think of, it's one of the main causes of death for teenagers, and also the other thing we tried to change, well, we want to get rid of being able to buy assault weapons, but when you look at the mass shootings, most of those, the people are between 18 and 21, and you can't buy cigarettes or alcohol until you're 21, and you could buy an assault weapon. That does not make sense. Now, with what we were able to get agreement on, there's tighter measures, but you can still, buy the gun. It, like I said, it's just so many things. And then also we need to strengthen alcohol, tobacco, and firearms. When you speak to them, they, would report that so much money was taken away from them that they couldn't do their jobs. They didn't have enough resources. So we need to, there's a new leader, and there's more resources going their way so they could check into these, gun stores. Because if you look in a lot of areas, you could trace the crime guns back to very few of the stores. It's like the same shops are the ones, or it's trafficking or store purchasing.
Okay, so you cover the Chicago area. By the way, audience, if you have any questions for Congresswoman Kelly, please put them in the question and answer box or in the chat box. Feel free to leave your questions there. So you cover Chicago, right?
Yeah, I start at 43rd Street. I really hug the lake because there's like 8 of us, I think, that have Chicago.
So it seems to be information, a lot of information about the increase in like carjackings and those kinds of things in the Chicago area. Do you think this has a little bit to do with the amount of guns that are available, or?
Well, it's funny, the carjacking really rose during COVID. And if you looked at who was doing it, it was teenagers. And what someone in law enforcement said to me is like parents, thought their kids were going to school, like it started happening, and then it just kind of caught on, and parents thought their kids were in school and they weren't in school. That's what they, were doing, because it wasn't, sometimes some of the, I don't know if there's a typical person that would do this, but all kind of people, were doing it. And so that, became a problem, and then it escalated, just like the same thing with shootings on the expressway. And I don't know if it was 2020 or 2021, there were like over almost 250 expressway shootings. And when I asked, what was the cause, and the head of the state police told me that some of it just starts on the internet, and people going back and forth, just like some of the, the gun violence. So it's very sad, very sad.
Wow. So you're dealing with things that can have a sad ending. What's going on with the mothers? What's going on? What can happen with gun violence? How do you stay motivated? How do you stay encouraged to make that change?
Well, I mean, just like with both, I feel like we, made progress, but also the other thing is like my colleagues and the moms I work with, like Annette Holt, the head of the Chicago Fire Department. She lost her son to gun violence, and Hadia's mom and dad, I work with them. They are so encouraging. If they could be out there fighting after their great losses, then certainly, I can do it also. And, I just feel like when we all do better, we all do better. And, part of my job is to try to, lift all boats, because we all benefit from that. We all lose when we lose, our kids and parents to gun violence. You might be losing the next scientist or, congressperson or, so we all lose, neighborhoods lose.
So I was looking through your site, and it looks like you're out and about on the ground, listening to those stories. How does your counseling degree come into play? As you
I often tell people my undergrad in psych and my master's in counseling helps even more on this job than the PhD in political science. Just the people I work with, not my constituents, but just the people I serve in Congress with. The counseling and psych helped me.
Definitely. So if there was a woman who was interested in getting into the political arena, what suggestions would you make to her?
Well, I would suggest, and this happens with me, calling someone that you feel like you can relate to, or you like what they're doing, or if there's a topic that you feel passionate about. It could be healthcare, it could be the environment, it could be education or the parks, whatever. Get involved with groups that deal with those issues, and learn from that how to advocate, how to lobby, so to speak, and those kind of things. And, talk to people who are where you want to be.
So the climate has gotten so difficult in running for offices that, they dig up everything possible from your past and that kind of thing. So what can we do to keep people encouraged that is, even despite all those kinds of things going on, for a person who just really wants to help?
Yeah. It's really a shame that happens, because we're all human. We've all made mistakes. There's something in all of our lives we don't want on the front page of the Chicago Tribune. And we keep good people from running because of things like that, and because of the money. I wish that we could take more of the money out of politics. Like in Congress, there's so many millionaires, and we should have a great diversity of people. Not that everybody's a millionaire, I'm certainly not, but there's a lot. And not just I have 1 or 2 million in the bank. I have 10 million or 50 million or 100 million, and of course, if you have that, people that have that, so it's easier for you to raise money. But, we like Maxwell Frost is 25 and he made it in. But when you listen to his story, he lived in his car as he was running for Congress. People should not have to do that. So we have to make those changes. And the other thing I would encourage people, do your own homework. Don't let the negative drive you. You know what I mean? Like, do your own homework. Someone might have said something a long time ago, but maybe they learned and they're not like that anymore. I think that people have to look at that too. We're all human. People make mistakes. People will still make mistakes after they get to Congress. So whatever you're doing, like I just hate that so much is negative, but unfortunately, sometimes that works. But look for what people say they are going to do or what they have done, not just always, putting down the other person.
Okay. So you've been there for 10 years. Are there some specific things that you really want to accomplish before you decide to give this up?
Definitely seeing some of the programs around gun safety and gun laws passed, to maternal mortality, and also in my district, even though my district is vast now, but seeing growth in economic development. We have seen some, and we've been beating the bush for many years, even when Congressman Jackson was a congressperson, to build a third airport. Everything that we learned says it's needed, a cargo airport. We have so much, we have a lot of manufacturing in the district and all of that. And we have a lot of agreement, across the district, Democrat and Republican. So that's something that I would like to see done. We're 90-something% there. So I'd like to see that done. And then also just that, people have access to healthcare, that they don't have to. I know there can't be a hospital in every town. I get that, but that there is more access. And then the other thing I think about is food and food deserts, that again, there doesn't have to be a supermarket, a big supermarket in every town. I have so many towns, but that people have access to food, because when you don't, like the studies that you could get a McDonald's before you can get an apple, nothing against McDonald's, but that's not the healthiest thing. And when you think about African Americans, how we're number one in so many of the diseases that Americans die from, we need to do better.
Okay. So you're in Chicago, which means you're probably connected to the Obamas. You're probably connected to Oprah.
No, I don't know Oprah.
You don't know Oprah? Well, Oprah
No,
needs to
I served in the state legislature with President Obama. He was in the Senate and I was in the House, and worked like a dog for him to be the senator and then to be the president. Then, of course, I saw him in DC because I came to Congress when he was the president.
Wonderful, wonderful.
And his library, I'm proud to say, will be in my district.
Yeah, so when does that open?
I think they're shooting for, if I'm correct, like 2025 or something like that. It's already started.
Okay, yeah, I think I get emails to contribute to that, but it looks like it's going to be a beautiful place.
Yes, and they're doing a lot of things already with especially young people.
Okay, so wow, this has been a wonderful, wonderful conversation, and I've learned so much about you and the work that you are doing.
Well,
what would you like to leave our audience with today?
I just think it's really important that democracy works when people are involved, and you don't have to be involved every single day, but whatever issue in your corner of the world that you're interested in, be involved in that. And of course, please make sure you vote. That's just so important, and use your voice. Your voice really, really does matter.
Wonderful. You have heard it from Congresswoman Kelly. Make sure you vote. Definitely, because we can't complain if we don't vote.
That's right.
And definitely we are working towards making sure that Medicaid gets expanded in Kansas, because we serve both Missouri and Kansas, but Kansas is not quite approving.
Yeah.
So hopefully your committee can get some work done there and connect with the Kansas Congress individuals to make that happen.
All righty.
All right. So thanks again for joining us today. We appreciate it. And we hope that you heal well from your ankle injury.
Thank you so much, and have a great day.
You too. Thank you.
Bye-bye.
Bye-bye.